We also run what's called an adrenal stress index. You can test the adrenal glands with a test, with this test. This is a salivary test, which is much like DNA testing. The adrenal glands sit right above your kidneys, and they are your stress organs, meaning that they react to stress. If your child's body has been or is currently under stress, this test must be ran. If your child suffers from insomnia or has difficulty sleeping, this test is a must because it's a direct measure of what their cortisol levels are doing. We also run immune panels, which are extremely, extremely important. Most ADHD and ADD patients that I have treated in my office suffer from an underlying autoimmune condition. This is why immune panels become so important. There are two parts to the immune system. You have the Th1 side and the Th2 side. Interleukin-2 and TNF-alpha are your Th1 cells. Th1 are your T cells. The T cells are the army that actually attacks and cleans up afterwards. They include your helper T cells, your suppressor T cells, your natural killer cells, your regulatory T cells, and really your macrophages. Interleukin-4 and interleukin-10 are your Th2 cells. Th2 are your B cells. These are what make antibodies. They are the post-it notes that tell the T cells what to attack. Okay? If you have a high B cell count, you're going to be Th2 dominant. So to properly evaluate the immune system and properly treat it, we run the T and B lymphocyte panel. We check your interleukin-2, your TNF-alpha, your interleukin-4, and your interleukin-10. We also want to determine if you have what's called, or if your child has what's called an active antigen pattern or an immune dysregulation problem. Active antigens are parasites, bacteria, viruses, yeast, foods, chemicals, and heavy metals that the body is actively trying to remove. The best indicator for an active antigen as the cause of the patient's abnormal dominance is the helper-suppressor ratio, which is on the T and B cell panel. This is also called the CD4 to CD8 ratio. The closer to 2.5 the ratio is, the more likely it is that your child's dealing with an active antigen. If the ratio falls below 1.2, then you're most likely dealing with an immune dysregulation problem. We also run what's called intestinal permeability testing. This test is used to determine if your child suffers from what's called leaky gut syndrome. Leaky gut syndrome is a condition where the walls of the intestines have been damaged and become inflamed. This is caused by antibiotics, toxins, poor diet, parasites, and infections. This leads to increased permeability of the gut wall to toxins, to microbes, to undigested food, to waste, and to really larger than normal macromolecules that your body would normally not take in. Once these substances leak through the gut wall, they can affect the body directly, or they can cause an immune reaction which will promote inflammation in the body and the brain. So how do I successfully address your child's positive metabolic findings? Well, I use specific nutritional protocols and lifestyle changes based on the results of your child's lab results. It's very specific. I also utilize a product called glutathione, which is a very powerful antioxidant that your body needs to decrease inflammation. Now, the second part of our treatment involves the neurologic side, rebalancing those brains. So what are the brain-based therapies that we use? We use oxygen therapy. It's one of the main sources of fuel for a brain. We use cerebellum rehabilitation, where we may have your child stand on a left leg and catch a ball. This stimulates your right brain. We use vestibular stimulation. Okay? We may use spins and head positions to stimulate various inner ear canals on the left side, which will then send signals over and cross over to the right brain and stimulate that right brain. We use hemistim visual stimulation. Okay, this is one-sided eye stimulation. We use auditory stimulation, low frequency stimulation, olfactory stimulation. We may use unpleasant smells to stimulate the right side of the brain and initiate that withdrawal response. So maybe have your child smell raw onions through the right nostril 5 times per day. We use gross motor training, meaning we rehab the postural muscles. We do cross crawl exercises, okay, neck raises, chest raises. We want to strengthen those core muscles. We'll do balance exercises. We also use state-of-the-art technology called the interactive metronome, which has been proven and well-researched to really help these kids. Our office sessions are usually 2 to 3 times a week for the first 90 days, and then we do a reevaluation. Treatments last 35 to 40 minutes. And then we also send home therapies. This is not an easy treatment. It requires commitment on your part. You're going to have to be willing to crawl through glass to get your child better. My program has extremely successful rates based on my unique approach, but also because of our comprehensive screening process. I really only accept children that I believe I can help. If after I assess your child, I feel that he or she is not a good candidate for our care, I'm going to refer you and your child to the appropriate specialist with your test results. Your child's brain function can be improved, and that's important to understand, and it adds hope. Again, the important thing to understand about my program is that it is specific to rebalancing the brain. The combination of my metabolic and neurologic treatments is what makes my program so successful. I want you to consider the following 4 factors in regards to your child's health and well-being. Number 1, I want you to picture yourself congratulating your son or daughter on a straight A report card. Finally, a report card that you can be proud of, okay? It's tougher and tougher for kids to get into colleges these days, so grades are becoming more and more important. It's hard work to compete in the business world and to have time for your family and your spouse and still have time for your son or daughter. I know, I'm a parent, I have 2 girls, and I love them very much. But even with that said, it's so important that we take the time to do whatever it takes to give our kids the best quality of life possible. This is a time-consuming process, but it's worth it. Number 3, we all know that better grades lead to college scholarships. I want you to imagine the joy your child feels receiving a scholarship, and as well as the light and load that's going to be put on your pocketbook. And finally, like I said before, if you really care and love your child, remember, you will have to literally crawl through glass to help them have the best life that they can live. I didn't say my program is easy. There is no easy fix for this, but I can assure you that the sacrifice is worth it. Now, in closing, I'd like to ask you that please share this information with your family members, your friends, that you feel it may help. As we mentioned earlier, there are millions of kids struggling with these same problems. I know that if you've taken the time to watch this video, that someone you deeply care about is being held back by ADD or ADHD. Please make sure to call my office now to get your child scheduled for a consultation with myself. We'll take the time to review your child's case history in detail and discover if your child qualifies for my program. I'm looking for parents that are warriors, parents that are willing to crawl through glass and do whatever it takes to get their child better. Thank you so much for taking the time to watch this video. I hope it was informative. My office number is 763-398-7770. Please call now and get your child in so we can get started to helping them. Thank you so much.